Welcome to the Pod of Inquiry, pushing the envelope for human understanding and optimization, the podcast for podiatrists. The Pod of Inquiry is designed to empower you with knowledge. What happens from there is up to you. Your host, Dr. Stephen Barrett, has designed this show to take you down some very deep rabbit holes, hopefully bringing you back out again, relatively unscathed, but cerebrally whipped, enabling a better understanding of all things worthy of inquiry. If you have more questions after the show, then that is good. The new discovery today many times was the new discovery 50 years ago, only to be suppressed or plainly ignored. Medicine and surgery can sometimes take a long while to get their paradigm shifted. We hope to have a lot of fun on this show and maybe destroy some ridiculous dogma along the journey. Thanks for joining the show today. Let's start spelunking.
I'm really excited for you to hear my conversation with this week's guest, Dr. Edouard Mills. Dr. Mills is an endocrinologist and researcher from the section of endocrinology and investigative medicine at the Imperial College of London. Dr. Mills is heavily invested into research about Kisspeptin, which is a neuropeptide that is integral in sexual function and arousal and as a behavioral modifier. Dr. Mills explains his research into how Kisspeptin functions and how it's being studied with functional MRI. I'm sure you will enjoy this episode and learn a lot into something that I think is going to make a lot of waves in clinical and functional medicine in the very near future once this bad boy gets discovered by the mainstream. And without any further introduction, please enjoy this episode with Dr. Edouard Mills. All right, I'm here with Dr. Edouard Mills, and we are going to discuss a subject today that I found fascinating, and quite frankly, I didn't know anything about it until one of his colleagues who we had on the show earlier, Dr. Matt Wall, shared with me. So, Dr. Mills, before we get started and talking about this interesting neuropeptide known as Kisspeptin, why don't you tell us a little bit about where you're from and how you got interested in this topic?
Yeah, well, thank you so much for inviting me. So I'm a clinical lecturer in endocrinology based at Imperial College London in the UK. Essentially, I've got a bit of a hybrid job where part of my week is spent doing clinical research in the field of reproduction. And then the remainder of my week is spent diagnosing and treating patients with reproductive disorders in the hospital setting. And I guess, how did I get into this? Well, my research very much looks at the relationship and the interaction between reproductive hormones and behavior. Mm-hmm. And I guess that's because as a practicing endocrine or hormone doctor, I've always been very much struck by the frequency which psychosexual symptoms, but also well-being problems are often a problem with hormone-related conditions. And one of the big issues that we have is that these symptoms aren't always alleviated when you treat the underlying cause. And so that very much inspired me to do some research looking at the brain pathways that were involved in psychosexual disorders, but then try and develop some new effective treatments for my patients.
So when was Kisspeptin first discovered?
Yeah, it's a good question. So it was probably back in about 1996.
Okay.
So Lee and colleagues first identified the Kisspeptin gene. And actually, at that time, they thought this was an anti-cancer gene rather than a gene to do with reproduction. And the sort of story behind it is quite interesting in that it was first identified at Pennsylvania State University, which we know is in the city of Hershey. And so Hershey itself is probably better known for its chocolate factory.
Right.
And its most famous product being Hershey's chocolate kisses.
Right.
And so what Lee and colleagues did was they named what they thought was an anti-cancer gene after Hershey chocolate kisses. And really at that point, they had absolutely no idea that it'd be so heavily involved in reproduction and so aptly named with the word kiss.
Interesting. I have a great affinity for Hershey, Pennsylvania. I actually 25 years ago, I think I went up there every year for maybe 5 or 6 years to lecture at one of the conferences. And what's interesting about Hershey is you can tell you're almost there by the rolling down your car windows because you can smell the chocolate in the air. So
it's an
interesting city for sure. So Kisspeptin's identified, what'd you say, mid-90s, probably?
1996, but actually
Okay.
it wasn't really until about 2003 that we started to have any idea that it was to do with reproduction. And that was because there were two simultaneous publications that were released actually within very short succession, but they were very separate research groups. So there was one group that was in Paris, and there was a second group that was a collaboration between Harvard and Cambridge. And what they essentially went on to show was that in those people where they've got inactivating mutations, so there's a loss of function in their Kisspeptin system, that those people fail to go through puberty, they were also infertile. Whereas the people who had activating mutations, so they had a gain of function in their system, they had precocious or early puberty. So this was very early signs that this was a hormone that was so heavily involved in reproduction.
And I think from reading in a few of your articles, there's a distinct difference in sexes as far as how much Kisspeptin is produced. Is that correct?
Yeah, so to an extent, so we know that it's heavily involved in reproduction for both men and women. And the reason being is that it is the hormone which sits at the very top of the reproductive axis. So that's the pathway which controls all of your reproductive hormones.
And that's the HPG that you refer to.
Yes, absolutely. So it's the hypothalamic pituitary gonadal axis. Hypothalamus because it's all the way at the top. Pituitary, which is like a P-shaped gland which sits under the hypothalamus, and then that controls all the way down to the gonads. So testes in men and the ovaries in women. And so ultimately it's making testosterone in a man, it's making estradiol in a woman, but it's very heavily involved in reproduction in both men and women.
And the HPG, it sounds to me like it's a very similar axis as the HPA axis.
Yes, that's absolutely right. So the hypothalamus being the gland which makes certain stimulatory hormones which make the pituitary gland then affect the target organ. So the HPA axis because it's affecting your adrenal glands, but the HPG axis because it's affecting the gonads. So it's a similar sort of mechanism. It's that this is the target organ at the end, so the gonads for the reproductive axis.
So I'm very rudimentary in this, but is it the same pathway in the HPG and the HPA axis except the end destination, or are they distinct pathways all the way through?
So they're distinct pathways all the way through in that the hypothalamus will make a hormone called gonadotrophin releasing hormone, which is GnRH. Right. That then stimulates your pituitary gland to make two hormones. One is luteinizing hormone, another is follicle stimulating hormone, and that's what controls the gonads. Whereas with the HPA axis, it's a different series of hormones, but it's same anatomical location, just different stimulatory hormones that we're talking about.
It appears that Kisspeptin is endogenously made both in the hypothalamus as well as maybe in the amygdala and certain other organs like the placenta and these types of things. Is that correct?
Yeah, and that's actually what's very fascinating about the hormone. So originally, when all this evidence came out in 2003, people thought this was purely a reproductive hormone. But then over the next sort of decade, we've now realized that it's made in lots of other areas of the brain. So not just the hypothalamus, but sort of corticolimbic brain structures, which are all important in behavior. And then also in lots of brain areas or parts of the body outside. So placenta, testes, ovary, liver. So it's given us this understanding that this is not just a reproductive hormone, but it's sort of pleiotropic. It's got lots of other functions, not just reproduction, sort of bone biology, metabolism, and obviously behavior, which is the bit that I'm most interested in.
And so if we go into the behavior a little bit, I thought that was really fascinating because, you know, you have this this neuropeptide that it appears that, does it upregulate dopamine and serotonin, or did I get that wrong too?
No, so it interplays with all of these. So it interplays with dopamine, serotonin, GABA, glutamate. And actually, these are all very behavioral neuropeptides. And so they've, for a long period of time, have had very established roles in what they do. But actually, we think that kisspeptin is probably another of those hormone interplaying with those to bring about some of those behavioral effects.
Yeah, and I think it's probably inextricably woven together that reproduction is going to be, as you point out in these articles, it's going to definitely be affected by mood and other behaviors, obviously. And so are they, I know that you're studying it primarily for infertility, is that correct? Or also male sexual dysfunction as well? I know that you looked at that in one of the articles that I read as far as...
We've done a whole host of different things. We've looked at the more classical reproductive effects of this hormone. So, for example, using it as a treatment for men and women that have problems with fertility. We've looked at it in terms of its effects. If you could use it, for example, in vitro fertilization, so IVF,
right,
to try and stimulate eggs in that setting. So that's one of the areas that we look at, so very pure reproduction. And then we've also looked at it in its context of using it to try and treat men and women that have got problems with sexual desire.
Right. And you pointed out in the one article where you talked about the hypoactive sexual desire disorder in men, that, I think that we're jumping around a little bit here, but that's the great thing about these conversations. It appears that there's a subset of males that have ED that don't do well with some of the classic drugs, and then kisspeptin may be like considered an adjuvant or maybe another substitute for that.
Yeah, so the group of men that we've been, well, and women as well, that we've been looking at are a group of people, as you say, they've got a condition called hypoactive sexual desire disorder. So these are the people that essentially have a persistent lack of sexual desire, and they're very distressed by it. And the diagnosis is if you've had it for more than 6 months. And actually, these are men and women that otherwise have no other medical or psychological problems that would better explain their sexual desire. And actually, they also have normal levels of their sex hormones. And very often in their life, they also would have had normal sexual function. So from that perspective, they are slightly different to people with erectile dysfunction. But what's interesting in what you say is that lots of people historically have always been told they've got erectile dysfunction, but actually they probably have this condition called hypoactive sexual desire disorder instead.
And it helped me differentiate that a little bit, because it seemed like they're almost one and the same to me, right?
So HSDD, the condition which we've been studying, is more to do with desire. So it's how you feel about sex, if you want sex. Whereas erectile dysfunction is more of an arousal problem. And it's often more of a sort of plumbing issue. So we see it in lots of men with diabetes, for example, where they've got problems with the blood vessels at the level of the penis.
Peripheral arterial disease.
Yeah,
smoking.
exactly.
Yeah, right.
So it's different in that one is more of an arousal condition or a deficit, which is erectile dysfunction. And then the other one is more of a desire issue, which is the HSDD, the hypoactive sexual desire disorder.
So it's possible that somebody with this could have a normal testosterone level or within normal levels. And so when they're tested, their doc's going to say, well, your T level's fine, go about life as it should be, but that doesn't necessarily correlate.
Exactly so. So actually, lots of these men and women are often sort of ignored slightly within the healthcare setting, because they go and see their doctor, they've got normal levels of their reproductive hormones, they're told there's nothing wrong with them, and so that's kind of the end of it. But actually, this is a treatable condition, and we know that it causes a lot of distress for people. So actually, people go around their lives, they've had often lots of relationship breakdowns because of problems with their desire. Their partners think that they're not interested in them.
Right.
So actually, this is a treatable condition, and I think often it's looked down on within the medical community, but that's often been because there's been no effective treatments. But within the last year, there's been a lot more interest in it, because we've shown, for example, with kisspeptin, that there are potentially interventions that these patients can receive.
Now, this is probably going to sound like a really stupid question, but I'll ask it anyhow. Is there a biomarker for kisspeptin levels? Can you draw somebody's blood out and see what their kisspeptin level is?
So we can. So we can do circulating levels. So we do a blood test. But the problem with that is that the levels of a normal person walking down the street is very low. So the levels are almost undetectable. So that doesn't really give you an idea about what's happening at the level of the brain. It just gives you a peripheral marker. So actually checking the levels in this context isn't that helpful. But we do check Kisspeptin levels for other conditions, and often it's more reproductive conditions rather than behavioral effects.
So would you have to maybe go to the CSF for that to get really what's going on in the brain to give you that level of?
So actually, that's really interesting, but probably not, because lots of these interventions are very invasive.
Right.
So really, that's why we've been using functional MRI, which gives us an idea of brain activation patterns non-invasively. So you don't need to do anything invasive to the patient or the participants, but you've got an idea about how Kisspeptin is stimulating certain brain areas, for example.
Let me unpack that a little bit, because you just said a lot in a very little amount of verbiage. So somebody comes into you with a hypoactive sexual desire disorder. You can probably get that through the HPI when you interview the patient and see what's going on. So you have this clinical suspicion that, all right, this individual, whether it's a female or a male, is low on Kisspeptin. Are you then just going to arbitrarily introduce that and then do the MRI? Is that how do you go about it? I mean, it's if you can't really measure it well in the blood, is it clinical suspicion?
It's exactly that. So it's exactly as you say. So at the moment, this is what we call a clinical diagnosis, meaning that you can only get the diagnosis from taking a very good history with the patient. There's certain behavioral questionnaires where the scores give you an idea, but really the defining feature is someone complaining of low sexual desire. It's persistent for more than 6 months. They're very distressed by it. You do lots of investigations, often from blood tests, and they don't have any other hormonal cause. They've got normal reproductive hormones. So really, this is what we call a diagnosis of exclusion. So there's nothing abnormal in the sort of assessment other than the symptoms that they've got. So, and actually, we don't really do the MRIs in a normal clinical setting. This is all from a research perspective that we're doing it.
Yeah, no, it'd be very expensive. And I understand the reluctance of wanting to do a lumbar puncture on everybody to look at their CSF. But, you know, I mean, the research and clinical are two different arenas. But let's go into the research a second, because that's really fascinating to see these functional MRIs and how things differentiate. And I think one of your studies, well, explain how you do that and how you image it, what you're looking for, because I think that's really interesting.
Yeah. So the imaging technique that we use is something called functional MRI. And essentially what that is a type of scan that allows you to look at brain activation patterns. And so it relies on fluctuations in blood oxygen levels when certain areas of the brain are activated or deactivated during a task. So for this particular study, what we did was we administered Kisspeptin to participants, but the task that they were doing was that in the MRI scanner, they needed something that was going to trigger their underlying sexual brain activity.
Right.
And so for the purpose of our study looking at reproductive behavior, they were actually watching pornographic videos on a screen that was in the MRI scanner. And so when they were then given Kisspeptin, it gave you an idea of which brain areas Kisspeptin was able to stimulate, but also which areas Kisspeptin was able to deactivate during the context of a sexual stimuli, essentially.
So you would think the activation is empirical, makes a lot of sense. The deactivation makes sense, I think, if you think about it a little longer, because, you know, you talked about some of the things like fear. Fear is definitely let's call it a buzzkill, for lack of the better way, right? Of putting it. But there are certain areas of the brain that increase their activity. And then what is it? Maybe a suppression of other things that can be more negative thoughts about it.
Exactly.
Okay. Yeah.
So we know that in this condition, hypoactive sexual desire disorder, you tend to get an imbalance in brain activity. So you tend to get hyperactivity in certain brain areas, so the very cortical brain areas that are involved in things like self-monitoring, self-judgment, self-control. And what that does, that overactivity then suppresses the more emotional limbic brain areas, which are your sexual desire and arousal centers. And so really what we wanted to see is whether Kisspeptin was able to restore that by dampening the areas which are hyperactive and then stimulating the areas which are your sexual arousal and desire centers. And actually that's what we were able to show, was that you were getting this restoration of brain activity.
Okay. So it knocks out the negative and accentuates the positive.
Yes, absolutely.
Interesting. All right. So in one of your articles that I read, you talk about how Kisspeptin affects things like audition or fear, but it's really interesting because if you think about it from a neurological standpoint, you have this substance that's circulating or not circulating around in your system, and it could make all the difference between your olfactory perception of a person versus when you have a level of Kisspeptin or when you don't. And you touch on pheromones and where you're talking about this, I think, and I know nothing about pheromones except, kind of the concept of it. And I know that I think animals are more dialed in because they have superior olfaction systems compared to humans. But I mean, and olfaction probably is one of the most primitive senses that there is. But how does it, like if I am with a person that wears a certain type of perfume and I don't have a Kisspeptin level that I should have, maybe it's not a great perfume. If I have my Kisspeptin levels up, now it might be a great perfume. Am I even close in that? And now a message from our sponsor. Well, folks, if you're over 40 and you're not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to health, not to mention the cardio protection. Nitric oxide is a physiological molecule that does so many things for your health. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, just go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration, and I am certain you will be pleased not only for yourself, but for all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see that nearly every one of them will be deficient. When they see this result, they will want you to start them on it immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates. Thanks for watching. You can start today.
So we actually did a study about maybe 4 or 5 years ago where we had men that had normal sexual desires. These were healthy men. Again, they've got normal testosterone levels. And we administered Kisspeptin to them. And we again did one of these functional MRI studies. Mm-hmm. And what we were looking at in this specific study was to see whether Kisspeptin affects attraction brain processing. And so, as you alluded to, in humans, the two main inputs to attraction are obviously smell, but also vision. So, right. Does somebody look attractive? Because, as you say, we don't really know the role of pheromones in humans, but we know that smell has quite an important role in attraction.
Right.
And actually, for that study, these were men, so we needed a female stimulus. And so the female stimulus that we used was Chanel No. 5, so a very well recognized perfume.
Right.
And the men in the MRI scanner saw lots of pictures of female faces. They ranged from highly attractive female faces to moderate to low, and these have been independently rated in a previous study. And what we showed was that Kisspeptin to these men with normal sexual desire was able to enhance all the brain areas that were involved in sort of olfaction, reward, sexual processing, and also was able to amplify brain areas that were involved in sort of aesthetic processing in the brain. So we were able to show that actually Kisspeptin not only affects sexual brain processing, but it affects the attraction brain processing in at the level of the brain as well.
So it made the Chanel No. 5 even better.
So we can't really necessarily say that, but what we can say is that it amplified all of the brain areas which are involved in olfaction, reward, sexual processing.
Okay. Might need to come out with a perfume that has Kisspeptin in it.
Well, that would be something that would be very interesting.
Yeah, it could be $1 billion product, maybe. Forget that regular Chanel No. 5. Let's go to the Chanel No. 105. You know. So let's talk about a couple of the other senses, and I guess you can call mood. It's not really a sense; it's more of a feeling. But if you think about it, if you're in a bad mood, you're probably likely not to be sexually aroused. I think that's pretty empirically established. So how does it affect mood?
So, I mean, as you allude to, so mood and emotions are obviously required for optimal reproductive health. So when your mood is off, when your emotions are off, you're less likely to want to have sexual intercourse. And actually, there's been plenty of animal studies, mainly shown in mice, where they've shown that Kisspeptin can actually have antidepressant effects. And what was very interesting was a study that our group did a number of years ago, where they showed that in healthy men, Kisspeptin administration was able to reduce negative mood. And that's obviously how an antidepressant works.
Right.
And so what would be a really exciting future area would be to see whether Kisspeptin's positive effects can also be seen in people with mood disorders. Certainly there is a real link between mood disorders and reproductive behavior, and they all kind of work together in the same sort of succession of events, really.
Dr. Mills, has anybody looked at Kisspeptin in the role of pain?
So there's been some work. So we know that there are Kisspeptin receptors, so the receptor what Kisspeptin binds to in some of the nerves in the skin. So there's been a bit of data on that. They've looked at, for example, seeing if it can be used in the context of migraine treatments, but actually lots of that work is quite at an early stage, and I don't think it's really been pursued that far. But you know, there's data out there, but it's mainly based on animal studies.
You would think that we know for sure that it takes a very short period of time when somebody develops a peripheral nerve injury to affect their neurotransmission. And it's almost impossible in severe pain to have a patient that does not have some component of anxiety or depression. So if something upregulates mood to a better state, you would think that might have a role, although it may not be a direct receptor on a nociceptor, but it could be, if I elevate this patient's mood, maybe they're able to tolerate this pain just a little bit more.
Potentially, yeah. And certainly that'd be an area which would be quite interesting to look at more in a human setting, as you say.
Now, let's talk about what are the adverse effects of Kisspeptin.
So actually, I think what's fascinating is that there are no adverse effects, and the reason being is that it's a naturally occurring hormone.
Right.
In fact, in our group at Imperial College London, we've probably given it to in excess of 500 men, women, and children now across our different portfolio of studies. And we've never detected a significant effect. And so, for example, there's no effect on blood pressure, on heart rate. And the reason being is that when we administer Kisspeptin, we're obviously causing physiological levels.
Right.
But the levels that we get are still certainly a lot lower than you get in other situations. So for example, during pregnancy, the levels of Kisspeptin go to about 7,000 picomoles per liter. So that's very high levels.
Oh, okay.
The levels that we induce are 5,000. They're still elevated, but they're a lot less than you would see in normal physiology. So the fact it's a naturally occurring hormone is what offers the fact that there are no side effects with Kisspeptin. So there's no safety concerns at all.
So is this being clinically utilized throughout the UK and throughout the US now for sexual dysfunction as well as helping with infertility?
So at the moment, it's very much still in a research setting. So lots of the work that's happening, particularly in humans, is coming out of our group at Imperial. And so we're looking at it in terms of, can it stimulate the reproductive axis in people with fertility problems? Can you use it in an IVF setting? But really, it's still very much a research setting. There's been a bit of work within the last few years looking at whether you can use analogs of these Kisspeptins. So what we administer is the natural hormone, but you can sort of chemically modify it to make its effects last longer. So there's been a bit of studies in that situation, but it's not something that you can go to a doctor and have prescribed. No, not at the moment.
And what about the administration? I would imagine because this is a pretty long chain peptide, you have to either be sub-Q or IM with it.
Yeah. So everything at the moment is parental. So intravenous, subcutaneous administration. So you can't give it orally. And as you say, it's a large peptide. So it's about 54 amino acids is the longest of the peptides.
Okay.
But over the last sort of couple of years, we've got some really exciting data that we've been doing where we've shown that you don't necessarily just need to give it parentally. So it doesn't just need to be injectable, but we've been showing that you can also give it by intranasal spray. So directly the same way as you'd use a nasal spray for hay fever, allergies. And we've shown that it can very robustly and increase reproductive hormone secretions. That's potentially another avenue in terms of its development long term, that it doesn't just need to be injections. It could also potentially be a nasal spray.
Is there any studies that are, looking at the interplay between oxytocin and Kisspeptin? Because, everybody talks about it, oxytocin being the love, I'm feeling great. Let's call it the empathic hormone, for lack of a better way to put it. Is there any interplay directly between oxytocin and Kisspeptin?
So we think there is. So a number of years ago, a group in Edinburgh in the UK did a study, and they were looking at the effects of Kisspeptin at the level of the amygdala. And what they were showing in that particular study was that there seemed to be some interplay between oxytocin, but also a number of other hormones. So for example, like vasopressin, dopamine, so all hormones that are having behavioral effects. But I think in a human setting, it's never been looked at, apart from in one study that we did a number of years ago, where we gave Kisspeptin and we showed that the levels of oxytocin didn't change. But as I mentioned before, these are peripheral levels that we're checking, but we don't know really what's going on at the level of the brain.
But we're able to discern some clinical benefits, even though you couldn't see any changes in the blood level.
Oh yeah, so in that particular study, but the effects that we saw probably were more direct from Kisspeptin rather than from the oxytocin anyway. So we showed that Kisspeptin was influencing brain activity, and it was also causing a reduction in sexual aversion. So these were healthy men, and that's actually what allowed us to catapult this forward and take it forward into this patient group of men with low desire. And
so in that patient group, how long have you followed them up? And let's go. Let me ask another question first, because as we get older, all things decrease, it seems like, that are healthy for us, like testosterone drops every year after a certain point in time, age 40 or whatever you want to use as your arbitrary benchmark. We know the same thing with nitric oxide. Endogenous nitric oxide drops 15-20% every year, depending on the individual. Does Kisspeptin drop like testosterone?
So we don't really know. The reason being is that the levels are so low in the blood anyway. Right. So we don't know the answer to that. I guess what's interesting more about the patient cohort that we look at is that these are men that are distressed. So it's entirely normal as people get older that their sexual desire will change. Often it drops. I guess the defining feature for this patient cohort is that they are distressed by it. And so that's what allows us to make the diagnosis of hypoactive sexual desire disorder rather than just medicalizing a normal phenomenon, which may be happening anyway to certain people.
This is going to be a wild conjecture, but is there any antagonist to Kisspeptin?
So there is. So there's a Kisspeptin receptor antagonist, which has been used only in animals, so in a rodent setting. Actually, one of the things that people often talk to us about is, could you use that in, for example, people who've got problems with hypersexuality, and therefore dampen their Kisspeptin system? Now, it's obviously very plausible that that would happen if you were to give it. I guess the problem with that is if you knock off the entire Kisspeptin system, then you're effectively chemically castrating somebody. So you suppress all of their reproductive access, but it's plausible that it would also, I mean, it would certainly affect their reproductive behavior as well.
Yeah, well, I was just thinking for patients that have sexual addictions or nymphomania or something like that. It may be something that could be looked at in the future. So let's go back to it. So these folks that you followed, as far as their distress, you were able to monitor them and see that their distress abated and then stayed that way, or what was your findings on that?
So the way that we administered Kisspeptin in that particular study was as a 75-minute intravenous infusion. And the reason we gave it as an intravenous infusion is that allowed us to control the Kisspeptin levels very well. But it also means that as soon as you stop the Kisspeptin infusion, that within typically about a couple of hours, the levels go back to completely normal. So what we were studying was more what the acute effects were on behavior, on brain activity. So there was no long-lasting effects, and that was just because it was given as an intravenous infusion. Now, obviously, what we need to be doing in the next steps now is looking what the effects are as if you were to give repeated administration. Would you continuously stimulate their sexual desire? But the work that we've done so far has mainly been in an acute, short setting. So although we were able to increase their sexual desire and arousal, that was only within the study period. Chances are within a couple of hours it had gone back to normal, but future studies now need to look at chronic administration, basically.
And so obviously IV is not a good modality for chronic administration, but obviously subcutaneous or IM would be pretty easy for folks to do.
Yeah, and certainly we can give Kisspeptin by subcutaneous injection. And there is a precedent, in fact, for using subcutaneous injections for sexual desire. So, for example, one of the treatments which is available for premenopausal women that have low sexual desire, and it's an FDA-approved drug, is something called bremelanotide, which is a melanocortin receptor agonist. And essentially, women give that as when required via subcutaneous administration. So, it's plausible that Kisspeptin could be given in that way, but also potentially via this intranasal delivery, which we're developing as well.
So is Kisspeptin available if somebody like in the functional medicine space that's a little more progressive than maybe mainstream medicine? I know the peptide is available out there. I've seen it, marketed by different compounding pharmacies. So is it being done anywhere? And if not, what do you see the future as far as clinical implementation for this over the next 2 years, 5 years, or whatever?
So, it's not commercially available. So it's lots of the peptides that you can buy are often labeled not for human use because they are designed for animal studies rather than somebody administering it at home. And I guess part of the problem is that lots of the work that's been done has been looking at the acute effects rather than, we don't know what all the long-term effects are. Now, clearly, it will have long-term effects and long-term beneficial effects, but there's been no studies looking at what repeated administration does, particularly for sexual desire. So really over the next, 5-10 years, the big interest will be looking at bigger patient groups, looking at broader populations, different sexual identities, orientations. So for example, postmenopausal women, these are all things that we need to be looking at. So broader cohorts, essentially, I think is where we're going.
Is Kisspeptin on the endocrinology map now? Is it on the radar where every endocrinologist is aware of this and they're diving into it, or is there still only the early adopters?
I think there's probably still only early adopters. I guess the reason why the average endocrinologist may not know about Kisspeptin is that for example, checking the levels is only something that can be done in a research setting. So there's only few labs like our lab at Imperial where we can measure levels for people.
Right.
And so people are very familiar with, hormones like testosterone, luteinizing hormone, follicle stimulating hormone, all the other reproductive hormones, but they're less aware of Kisspeptin. But we hope that over the last sort of 10 years, lots of the work that we've been doing has made people a lot more aware of it. And particularly as, new treatments are developed based, I'm sure it will become even more part of the armory of what an endocrinologist is going to be using and prescribing.
And same thing probably for infertility as well. That's a pretty big market in the medical place.
Yeah, very much so. And so the group a number of years ago did a study where they looked at women that were at high risk of complications from IVF. So one of the big complications that women can get is something we call ovarian hyperstimulation syndrome, where you overstimulate the ovaries, produces too many eggs, and sometimes that can be detrimental to women. And so we looked at using Kisspeptin as a sort of more natural stimulus of egg maturation. And so it showed very promising results, particularly in the women that were at high risk of this complication. And so there needs to be now studies looking at it in a bit more detail in terms of IVF settings, but there's lots of promising initial results anyway.
So what you're saying there, if I understand it, is that in lieu of what they're traditionally using to increase the egg count, they may just be able to substitute Kisspeptin, or would it be an adjuvant?
So it'd be probably an adjuvant, but it'd be an adjuvant instead of one of the other drugs which causes this high risk of this complication, particularly in the high-risk women.
Interesting. And so which do you think is going to come on the clinical horizon first, the hypoactive or the infertility space?
Difficult question. I guess for pharmaceutical companies, which often lots of the original work is done in a university setting, and then it's these big pharma companies which pick up drugs. I'm sure that they often go for the ones which are going to be more lucrative. And I suspect the hypersexuality conditions are going to be the thing that they may go for.
Interesting. Yeah, it's very expensive to get an NDA through and all of that. So the likelihood is they would pick their most promising market, I would think, and go with that rather than trying to get multiple indications all at once. So this is fascinating stuff. I mean, I asked a few of my colleagues within the last couple of weeks, since I know that we were going to be talking, just off the cuff, hey, have you ever heard of Kisspeptin? It's like, they look like, what are you talking about? So I think it's really interesting. And I think once this becomes more known, especially in the endocrinology space, if it's got very little adverse effects, like most natural things do, I would see that once the knowledge is conveyed, that there'd be a pretty big, people would pick up this technology and start to implement it more clinically. I don't think there would be a big hurdle with it.
No, we completely agree. And it's obviously what's fascinating is that it's not just a hormone which affects reproduction, but it's all these other domains as well. So behavior, metabolism, and there's lots of data coming out about its effects on bone. So, it's a fascinating hormone that it affects so many different important things. And if it's a very clean and safe drug, then it's excellent, really.
Well, let's talk about bone a second, since you brought it up. I mean, that, osteopenia is one of the big things, especially for females. How does Kisspeptin relate to bone?
So we've shown over the last couple of years that the Kisspeptin receptor is on a number of different types of bone cells that were involved in building bone. And we did a study a few years ago where we showed that if you gave Kisspeptin to men that have a normal testosterone level, they're young men, that it can actually increase bone turnover markers that are a sign of bone formation, but also it may also suppress the bone resorption. So these are all things which contribute to osteoporosis. So potentially this could also be a treatment for, as you say, low bone mineral density.
Right. It could even play a role in, Charcot neuroarthropathy, where you have this incredible wasting of the bone, and they're still trying to figure out the physiology on that. But again, I would think that if it plays a role in maybe obviating osteopenia, that and with its really low side effect profile, it could be a good fit for a lot of people.
Yeah. I mean, lots of the drugs that we use for osteoporosis are, very effective, but they also come with side effects. So if we're able to offer something which doesn't have a side effect profile, then that would be very promising.
Yeah. And one of the things I just recently discovered, and I have to do a little bit more research before I would pontificate on it a lot, is that some of the bisphosphonates actually, they do show an increase in calcium deposition, but they do nothing as far as cortical bone strength or even trabecular bone strength. So it's like, all right, we made this bone look better on X-ray, but did we do anything for the patient?
Difficult to know. So we know that lots of the drugs, obviously, they're very effective in reducing the fracture rates, which I guess is the end point that you're always trying to prevent when somebody's got osteoporosis. Is fractures, hip fractures, vertebral fractures, because these are all they cause significant morbidity and mortality to patients. So the bisphosphonates in that sense do work very well. Right.
Well, what else about Kisspeptin does the audience need to know? What do they need to look out for on the horizon? Because I think this is going to become more of a commonplace term in discussions among colleagues in the future.
I guess we've sort of broadened people's horizon. So people have always just thought of it as this reproductive hormone. You can use it to stimulate the reproductive axis. You can cause increases in these reproductive hormones. You can use it in, IVF. But I guess the big interest that people really have now is all the behavior stuff. Mm-hmm. So we've shown in men and women now that it can enhance sexual desire and arousal. And I guess the next bit that potentially people need to be thinking about is what's its effects on mood. So as I said earlier, it seems to be causing an antidepressant-like effect in rodents, in healthy people. So I guess the next thing is what happens when you use it in people with mood disorders. So I guess it's all the behavior thing that I may be slightly biased because that's my research area, but I think it's the mood and behavior stuff which is going to really take off.
No, I think there's a bigger marketplace for depression than probably any other condition that I can think of. I mean, this is very, very interesting. And I like the fact that you can intervene without a lot of side effects. That's really, I mean, everything we do as physicians, it's risk versus benefit. And how much benefit will they get versus how much risk do they have to take? And if you have something that has a very low profile of a risk and a high profile of benefit, people can jump on board with that pretty quickly. And, so I agree with that 100%. But anyhow, thank you for this wonderful introduction to this peptide that really not many people know about. And hopefully we can get more people knowing about it and following your research. So thanks so much for coming on.
No, thank you for inviting me.
Several years ago, I chose Alpinion as my ultrasound brand of choice after years of experience and research into ultrasound imaging. In fact, I have 2 of their machines. Alpinion has incredible precision and penetration built into their technology that, in my opinion, is simply the best value in all of the ultrasound imaging space. They have several price points to meet your needs, and I can tell you definitively that you'll end up having to pay double to achieve the equivalent imaging quality from other top brands. That doesn't even account for the unlimited software updates and remote tech support included with no monthly fees. Right now, to show their appreciation for the listeners of the Pod of Inquiry, they're offering an incredible discount. Their portable i7 retails for $21,000, but you can get it discounted at most medical meetings for $19,000. But my listeners will get it discounted to $15,900. This has never been offered anywhere for the new portable system with the engine of a console system. Use code SBPOI to take advantage of this incredible offer. You won't be disappointed with Alpinion. I sure haven't been.
We hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes, found at our website, podofinquiry.com. If this incredible and educational conversation has tickled just a little bit of your cortex, please leave us a review and spread the message to your friends and colleagues. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.